Hello everyone. Today we will discuss on Glasgow Coma scale, commonly known as GCS. This scale we use to assess the level of consciousness of the patients, especially those patients who are having head injury, brain injury, encephalitis, meningitis, or any other neurological disorder. So the main objective was to assess the patient's level of consciousness, and this scale should be used to prevent confusion with the terminology and quickly detect changes or trends in the patient's level of consciousness. As we all know, the level of consciousness is the most sensitive indicator of overall brain function. So we will be able to find out if there is any changes in the brain function by performing this assessment of Glasgow Coma scale. This scale was invented by Brian Jennett and Graham Tisdale. So here we can see the scale. So here mainly there are three behavior, that is eye opening, verbal response and the motor response. So under the eye opening we will assess for four responses. First is spontaneous. So as we all know, spontaneous eye opening means when the person will enter in a room and the patient will automatically open his eye. That will be the spontaneous eye opening, and then we will give a score of 4 if the patient has a spontaneous eye opening. Now, if the patient doesn't have a spontaneous eye opening, then we will try to call the patient by his name. And after that, if the patient is responding, then we will give the score of 3. That means he is opening his eyes to speech. Next, if the patient doesn't respond even after calling him, then we will try to give a pain stimuli to the patient. And if then the patient has an eye opening, then the score will be 2. Lastly, if there is no response, that means the patient has not opened his eyes at all, then the score will be 1. Next, moving to verbal response. First is oriented. That means we have to assess the orientation of the patient. In order to assess the orientation of the patient, we have to see whether he is oriented to time, place, and person. For time, we can ask the patient what is today's day or what day of the week is it. Next, for place, we can ask the patient where his address. Next, for person, we can ask the patient to identify his attendant or relatives available. If the patient is able to give correct answer to these 3 questions, then the score will be 5. Next is confused. Here again, if the patient is a bit confused while giving the answer of the questions, then the score will be 4. Next, while asking question, if the patient responds in inappropriate words which are not relevant to the question, then the score will be 3. Next, if the patient is making incomprehensible sounds which are meaningless, the score will be 2. Nextly, if the person doesn't have any kind of verbal response, that means there is no response at all, then the score will be 1. The third behavior is motor response. So here first is obey command. So the nurse has to give certain commands related to movement to the person, and the person will try to follow that. If the patient is able to follow the commands, then the score will be 6. Nextly, we will try to give some pain stimuli to the patient, and the patient is able to localize the area where we have given the pain stimuli, then the score will be 5. Nextly, after giving the pain stimuli, if the patient tries to withdraw his limbs, then the score will be 4. If there is abnormal flexion after giving the pain stimuli, which is also called as decorticate, then the score will be 3. After that, if there is abnormal extension, that is decerebrate, after giving a pain stimuli, then the score will be 2. If there is no response at all, then the score will be 1. So now we have came to know how to assess the GCS. Next, very importantly, we need to know about the interpretation. If the findings come as 13 to 15, then we will consider it to be mild. If the scoring come as 9 to 12, then it is moderate. And if the scoring is 3 to 8, then it is severe. This was all about GCS, that is Glasgow Coma Scale. Thank you.